12 hours. Okay? So when we admit this patient, we will ask a few questions about the symptoms of urinary tract infection.
Sorry.
Okay? You have to assess patient by abdominal examination, looking for any suprapubic fullness and distension that indicate patient has urinary obstruction, because you want to differentiate, is it urinary obstruction or patient has anuria, right? There is no urine output, right? So there is suprapubic distension, yes, suprapubic distension. And then we have to do digital rectal examination for this patient, confirm yes, we have prostatic enlargement, it can be part of the assessment. But the important step is to how to relieve this obstruction. That can be one of the indication for urinary catheterization. Urinary catheterization. Urinary catheterization, you have to choose the proper size of the catheter. You have different type of the catheter. This is the three-way catheter. I think it's suitable for patient with urinary obstruction. Three-way. This is two-way Foley's catheter. Which one can you use? Foley's catheter. Yeah. So what's the indication for three-way catheter? What will be the indication? By the way, this revision is, for your clinical practice and for your what they call cumulative skills until year 5, because I don't have idea about your exam questions. So that's good, huh? You don't have any idea about your OSCE exam questions. That's why I'm free to discuss anything this way. Professor J is preparing your questions. I will know during your exam only. Okay? So, three-way catheter. Why I told you this? I want you to keep this information for your long memory. Not for the short memory, okay, just for the exam. It's important for, no, this is important for your knowledge, yes. Indication?
Irrigation.
For irrigation, yes, good. If patient has hematuria, sometimes patient reasons for passing blood with urine. If I insert this one, okay, I can insert this one. I can insert this catheter and urine will come out, but sometimes there is clots. The clots will easily block this one, and there is no more urine output. And patient has abdominal distension because of the urinary obstruction. But this one, we insert the three-way catheter, we will put one for irrigation. So continuous irrigation of the fluid, so can wash out the blood and will not form any clotting inside. Okay, so we ensure the indication for this patient. For example, patient unable to pass urine, we choose the proper size and type of the catheter. We should have the urine bag. Okay, we should have the urine bag. Okay, we know how to use the urine bag, how to connect. Sure. No, do you know how to connect?
I'm not sure. Or just connect.
Yeah, how to connect? How to connect? Surprise, many of you, not of you, from previous group, yes, in the exam, you connect this one. You connect like this.
No.
Wow. Yeah, really sad. Become very sad after the exam. Because I hear that I'm very tired, but still don't know how to connect the CBD. Okay, some simple mistake is okay, and then, but this one very simple, very simple. If you don't know how to connect, that's mean maybe for 10 weeks in the hospital, you haven't seen any patient with CBD. Most of the patients, most of the time, they will have CBD, right? So very easy to know. This one is in the ground, that's one to the patient. Common sense. Okay, I hope no one will do this, huh? Okay, so we have the urine bag, we have the catheter, and we have the important thing to have any flame, right? What else do you need? Gloves, sure, we should have gloves. We should have syringe. Sometimes you need 2 syringes. It can be selective, not necessary, but 2 syringes is good. One will be used for the balloon, and one will be used for the local anesthesia. Local anesthesia for lubrication and local anesthesia. Okay. So I should have the local anesthesia, xylocaine gel. Okay, and they should have the what do you use for balloon?
Normal saline.
Normal saline. Normal saline. Sure.
Sure.
Normal saline.
Distilled
Who
water.
won't use normal saline still?
Distilled water.
Huh? Distilled water. Why distilled water and not normal saline? Normal saline is wrong. Normal saline is wrong. In the exam it will be negative marks. Normal saline is okay. I can inflate the balloon. It's very easy with normal saline. But when you come to deflate the balloon, you cannot. This crystallization will need to block the balloon. You cannot deflate the balloon. So that's why we cannot use the normal saline. We use distilled water. Okay? So we have distilled water here. Okay, prepare. How much we prepare distilled water for inflation? How much? According to the cafeteria, yes, you can retain it. It's mentioned here. 30 ml. Okay, this is the maximum, right? 30 ml. This is the maximum. So I can do 20, 25. Okay, so the maximum is 30 ml. Okay, so prepare my 20 ml of distilled water. Prepare the antiseptic solution. Usually we use the chlorhexidine. You can use chlorhexidine. Okay, we should have the forceps. Okay, the cotton, and put patient in the correct position, spine position, and inform the patient that you are starting to clean the patient after you have your chaperone again. This preparation, privacy, and you start to clean. You don't have it. There is no need to take photo because this is not correct. Okay. I don't have forceps. I don't have chlorhexidine, but you have to imagine. You have the chlorhexidine. Take the cotton. You have to hold the penis and start from. This is non-sterile. Okay, my hand is non-sterile now. Okay, so from the tip to the 1, 2, 3 chlorhexidine. Okay, then next either you change your glove or sometimes what I do for chemical practice I do double glove. So after I finish this one I remove one glove. So now I'm sterile again. Okay, you put the trap and prepare your catheter. Test your catheter. I inject the local anesthesia first. Okay, inject the local, so it will take time to function. Okay, you hold it for a while, maybe 1 minute. Okay, but not in the exam. The exam is just you mission. You hold for 1 minute. Okay, and then you test your tube. Usually, to test we can use air. Okay, not necessarily, just we can use air. This is the tube. Intact? Yes, the balloon is intact, functioning. Okay, good. Okay, now I put more lubricant in the tip of my tube. I should have gloves, right? And you should hold the penis on the 90 degrees. Okay, this is because the urethra is going down.
Yes.
So if this one will be kinked. Okay, so you cannot insert this one like this. So when it is 90 degrees, so it's easy to less curve and to insert the catheter. Okay. So from the patient, I'm going to insert the catheter now. Please take deep breathing. Okay. So we insert gently, gradually. You can feel the prostate. Yes, I can feel the prostate. It's quite resistant now. Okay, going to the urinary bladder. Okay, now I'm in the urinary bladder. I can feel the resistance when it's like this. Okay, with practice it will be very easy for you to feel the prostate because it's the narrowest part, prostatic urethra, and then you go to the urinary bladder. Okay, but I have to go more advanced until the end. Okay, so be sure that it's not kinked. It's not kinked inside. Okay, so it's not like this. Okay, kink, and I'm still inside the prostate. If you inflate, you're causing bleeding and maybe structure and injury to the urethra. So it's very important. Be sure that you are already inside the urinary bladder by fully insertion of the catheter. Okay? I cannot see anything from here, right? Sometimes you have this one transparent. You can see the. Okay. Now, next step. Okay. Sometimes we need to connect the urine bag before insertion, so we don't have any dish here. Or we have your kidney dish. I have my kidney dish, so when I'm already inside, I can see the urine is coming out. Okay. Next step. Connect your urine bag. Okay, be sure the urine is coming out, and then do inflation with normal saline. Again, I'm sure some of you will mention normal saline. Okay, and you do inflation of the balloon. Okay, with about 20 cc of distilled water, and then we will. I hope it will not come out. Okay, yes. Okay, so you can see it's inside the urinary bladder. Okay, then we fix this one on the side of the patient. You remove your trap and you put your plaster on that side, and you have to record. This is the end step. Most of you, they will not do that one, which is very important. I have to confirm the urine output, confirm the amount, and confirm the color, and document my finding. Clean the patient and inform the patient that I have finished the procedure. Okay, clear? Any question?